Question 1. The investigation demonstrates that a medical laboratory assistant, MLA, has identified a critical value result for a patient. The laboratory's policy clearly outlines a procedure for immediate verbal notification of critical values to the designated healthcare provider, followed by documentation of this communication. The MLA has correctly identified the critical value and has the necessary information to report it. Which of the following actions best represents the appropriate response for the MLA in this situation, adhering to documentation and reporting requirements? Option A. Prepare a formal written report of the critical value and send it via internal mail to the physician's office. Option B. Verbally report the critical value directly to the physician responsible for the patient's care, confirming they have received and understood the information, and then document this verbal report in the patient's record. Option C. Inform a fellow laboratory technician about the critical value so they can relay the information to the physician. Option D. Document the critical value in the laboratory information system and wait for the physician to request the full report. Correct answer is B. Verbally report the critical value directly to the physician responsible for the patient's care, confirming they have received and understood the information, and then document this verbal report in the patient's record. Explanation. Scenario analysis. This scenario presents a common challenge in medical laboratory settings, ensuring accurate and timely reporting of critical results while adhering to strict documentation protocols. The professional challenge lies in balancing the urgency of a critical finding with the need for meticulous record-keeping and communication to prevent patient harm. Misinterpretation or miscommunication of critical values can have severe consequences for patient care. Correct approach analysis. The correct approach prioritizes immediate, clear, and documented communication of the critical result to the appropriate healthcare provider. This aligns with regulatory requirements for critical value reporting, which typically mandate verbal notification to a designated individual and subsequent documentation of this communication. This ensures that the patient receives timely intervention based on the critical finding. Best professional practice dictates that the medical laboratory assistant, MLA, must follow established laboratory protocols for critical value notification and documentation, which are designed to meet regulatory standards and patient safety objectives. This includes confirming the recipient of the notification and documenting the time, date, and content of the communication. Incorrect approaches analysis. One incorrect approach involves delaying reporting until a formal written report is generated. This fails to meet the urgency required for critical values and violates regulatory mandates for prompt notification, potentially leading to delayed patient treatment and adverse outcomes. It also bypasses the established protocol for critical value communication, which is a significant ethical and regulatory failure. Another incorrect approach is to verbally inform a colleague who is not the designated recipient for critical value notification. While seemingly a step towards communication, it deviates from established protocols and does not guarantee the information reaches the responsible clinician. This can lead to a breakdown in the chain of communication, a regulatory violation, and a failure to ensure patient safety. A third incorrect approach is to document the critical value in the laboratory information system, but not verbally notify the healthcare provider. While the system documentation is important, it does not fulfill the requirement for direct, verbal communication of critical results, which is a cornerstone of patient safety protocols and regulatory compliance for critical values. This omission represents a failure to follow established procedures and a potential risk to patient care. Professional reasoning. Professionals should employ a decision-making framework that begins with identifying the nature of the result, e.g., critical value. If it is a critical value, the immediate next step is to consult the laboratory's established policy and procedure for critical value reporting. This policy will outline the specific steps for verbal notification, including who to contact, what information to convey, and how to document the communication. The MLA must then execute these steps precisely, confirming receipt of the information and meticulously documenting all actions taken. This systematic approach ensures compliance with regulatory requirements, upholds ethical responsibilities to patient safety, and minimizes the risk of errors. Question 2. The monitoring system demonstrates an increase in the prevalence of airborne bacterial pathogens within the general laboratory environment. As a certified medical laboratory assistant, what is the most appropriate initial step to ensure adequate protection for yourself and your colleagues? Option A. Immediately don the highest level of personal protective equipment available for all laboratory tasks until the situation is clarified. Option B. Review the laboratory's biosafety manual and consult with a supervisor or biosafety officer to conduct a specific risk assessment for the identified pathogens and associated procedures, informing PPE selection. Option C. Continue with existing personal protective equipment protocols, assuming current measures are sufficient for general laboratory environments. Option D. Select personal protective equipment based on the general classification of the identified bacteria and common laboratory practices. The correct answer is B. Review the laboratory's biosafety manual and consult with a supervisor or biosafety officer to conduct a specific risk assessment for the identified pathogens and associated procedures, informing PPE selection. Explanation. Scenario analysis. This scenario is professionally challenging because the monitoring system indicates a potential increase in airborne pathogens, directly impacting the safety of laboratory personnel. A failure to accurately assess the risk and select appropriate personal protective equipment, PPE, could lead to occupational exposure, transmission of infectious agents, and potential breaches in biosafety protocols. This requires careful judgment to balance the need for protection with the practicalities of laboratory workflow and resource allocation. Correct approach analysis. The correct approach involves a systematic risk assessment that considers the specific pathogens identified, their routes of transmission, the procedures being performed, and the potential for exposure. This aligns with the principles of occupational health and safety regulations, which mandate employers to identify hazards, assess risks, and implement control measures, including the provision of appropriate PPE. For a certified medical laboratory assistant, this means understanding the limitations of their role and escalating concerns when necessary, ensuring that the selected PPE is adequate for the identified risks, thereby upholding ethical responsibilities for personal and colleague safety. Incorrect approaches analysis. Selecting PPE based solely on the general category of the identified pathogen without considering the specific procedures or potential for aerosolization is a regulatory failure. It bypasses the detailed risk assessment required to determine the appropriate level of protection, potentially leaving staff inadequately protected. This is ethically unsound as it prioritizes expediency over safety. Choosing PPE based on historical practices or what is readily available without a current risk assessment is also a significant failure. Regulations often require periodic review and updating of risk assessments, especially when monitoring systems indicate changes. Relying on outdated information can lead to the use of ineffective PPE, violating biosafety guidelines and posing an ethical risk to laboratory personnel. Opting for the highest level of PPE for all situations, regardless of the assessed risk, is inefficient and can create unnecessary barriers to workflow, potentially leading to improper use or removal of PPE. While seemingly protective, it deviates from a targeted risk-based approach mandated by many regulatory frameworks and can be an inefficient use of resources. Ethically, it may also create a false sense of security if not implemented with proper training on its correct use and limitations. Professional reasoning. Professionals should approach this situation by first consulting the laboratory's biosafety manual and relevant occupational health and safety guidelines. They should then collaborate with supervisors or biosafety officers to conduct a thorough risk assessment for the specific procedures associated with the identified pathogens. This assessment should inform the selection of PPE, ensuring it provides adequate protection against the identified routes of transmission. If the monitoring system indicates a change in risk, the assessment and PPE selection must be reviewed and updated accordingly. Escalation of concerns to appropriate personnel is a critical part of professional responsibility when uncertainty exists or when existing controls appear insufficient. Question 3. Performance analysis shows a consistent, albeit slight, deviation in the calibration curve for a critical chemistry analyzer. The medical laboratory assistant has observed this trend over the past 3 shifts. What is the most appropriate immediate action according to College of American Pathologists, CAP, guidelines for ensuring laboratory quality and patient safety? Option A. Adjust the calibration factors manually to bring the curve within acceptable limits before reporting. Option B. Continue running patient samples but document the deviation in the instrument's logbook for future review. Option C. Attempt to recalibrate the instrument using the standard operating procedure without informing a supervisor. Option D. Immediately notify the laboratory supervisor or designated technical personnel about the observed calibration trend. The correct answer is D. Immediately notify the laboratory supervisor or designated technical personnel about the observed calibration trend. Explanation. Scenario analysis. This scenario presents a common challenge in medical laboratory settings where a medical laboratory assistant, MLA, identifies a potential issue with a critical piece of equipment. The challenge lies in balancing the urgency of patient care with the need for accurate and reliable testing, while adhering to established protocols and guidelines. The MLA must exercise sound judgment to determine the appropriate course of action without overstepping their defined scope of practice or compromising patient safety. Correct approach analysis. The correct approach involves immediately notifying the supervisor or designated personnel about the observed issue. This aligns with College of American Pathologists, CAP guidelines, which emphasize clear communication and prompt reporting of any deviations from expected performance. CAP standards mandate that laboratory personnel must be trained to recognize and report instrument malfunctions or quality control failures. By escalating the issue to a supervisor, the MLA ensures that the problem is addressed by individuals with the authority and expertise to troubleshoot, validate, or remove the instrument from service, thereby upholding the integrity of patient testing and adhering to regulatory requirements for quality assurance. Incorrect approach is analysis. One incorrect approach is to attempt to troubleshoot the instrument independently without proper training or authorization. This violates CAP guidelines that define specific roles and responsibilities within the laboratory. Such actions could lead to further instrument damage, inaccurate results, or delayed reporting of critical patient information, all of which are serious regulatory and ethical failures. Another incorrect approach is to ignore the issue and continue using the instrument. This is a direct contravention of CAP's quality management system principles, which require proactive identification and resolution of problems that could impact test accuracy. This failure to report a potential issue jeopardizes patient safety and can lead to misdiagnosis or inappropriate treatment, representing a significant ethical breach and a violation of laboratory accreditation standards. A third incorrect approach is to document the issue but not report it immediately to a supervisor. While documentation is important, delaying the notification prevents timely intervention. CAP guidelines stress the importance of immediate reporting to ensure that corrective actions are taken promptly, minimizing the risk of compromised patient care. This delay constitutes a failure in the quality assurance process. Professional reasoning. Professionals should adopt a decision-making process that prioritizes patient safety and regulatory compliance. When an anomaly is observed, the first step is to assess its potential impact on patient care. Next, consult established laboratory protocols and the scope of practice for the MLA role. If the issue falls outside the MLA's direct resolution capabilities or requires supervisory oversight, immediate and clear communication with the supervisor or designated personnel is paramount. This systematic approach ensures that all issues are addressed appropriately, maintaining the highest standards of laboratory practice, as mandated by accrediting bodies like CAP. Question 4. Quality control measures reveal a small, contained spill of a common laboratory reagent on the benchtop. The medical laboratory assistant, MLA, has been trained on the importance of material safety data sheets, MSDS, for all chemicals used in the laboratory. What is the most appropriate immediate action for the MLA to take? Option A. Continue with the current task, assuming the spill is minor and poses no immediate risk. Option B. Inform a colleague to handle the cleanup while the MLA finishes their current task. Option C. Consult the material safety data sheet, MSDS, for the specific reagent to determine the appropriate cleanup procedure and necessary personal protective equipment. Option D. Immediately discard the spilled reagent and any contaminated materials into the general waste bin. The correct answer is C. Consult the material safety data sheet, MSDS, for the specific reagent to determine the appropriate cleanup procedure and necessary personal protective equipment. Explanation. This scenario is professionally challenging because it requires a medical laboratory assistant, MLA, to interpret and act upon information from a material safety data sheet, MSDS, in a situation where a potential hazard has been identified. The MLA must prioritize safety and regulatory compliance, while ensuring laboratory operations are not unduly disrupted. Careful judgment is required to balance immediate safety concerns with the need for accurate information and proper procedure. The correct approach represents best professional practice because it directly addresses the identified issue by consulting the MSDS for the specific chemical involved. This aligns with regulatory requirements for workplace safety, such as those mandated by OSHA, Occupational Safety and Health Administration, in the U.S., which require employers to provide access to MSDS and train employees on their use. Following the MSDS guidance ensures that the MLA takes appropriate protective measures, handles the substance correctly, and knows how to respond in case of an incident, thereby minimizing risk to themselves, colleagues, and the environment. This proactive and informed response is a cornerstone of laboratory safety protocols. An incorrect approach of ignoring the spill and continuing work is a significant regulatory and ethical failure. It violates OSHA Hazard Communication Standard, which mandates that employers inform employees about chemical hazards and implement protective measures. Ethically, it demonstrates a disregard for the well-being of oneself and others, potentially leading to exposure to hazardous materials and adverse health effects. Another incorrect approach of immediately discarding the chemical without consulting the MSDS is also a regulatory and ethical failure. MSDS provides specific disposal instructions based on the chemical's properties and potential environmental impact. Improper disposal can lead to environmental contamination and violations of EPA, Environmental Protection Agency, regulations. Ethically, it bypasses established safety protocols and could lead to unforeseen consequences. Third incorrect approach of only informing a supervisor without taking any immediate action based on the MSDS is a partial failure. While informing a supervisor is important, the MLA has a responsibility to take immediate, appropriate action as guided by the MSDS if the situation allows and does not pose an immediate severe risk. Delaying action based solely on waiting for instructions, when the MSDS provides clear guidance for minor spills, can be considered a lapse in professional responsibility and a potential safety risk. The professional decision-making process for similar situations involves a systematic approach. 1. Recognize the potential hazard. 2. Immediately consult the relevant MSDS for the specific chemical. 3. Follow the MSDS instructions for containment, cleanup, and personal protective equipment. 4. If the spill is beyond the MLA's training or the MSDS guidance, or if there is immediate danger, evacuate the area and notify the supervisor or emergency personnel. 5. Document the incident and the actions taken. This process prioritizes safety, compliance, and informed decision-making. Question 5. The evaluation methodology shows that a medical laboratory assistant is responsible for receiving and preparing various specimens for analysis. When presented with a urine sample for drug screening, a blood culture bottle, and a capillary blood sample for a complete blood count, what is the most appropriate process optimization strategy to ensure specimen integrity and accurate downstream testing? Option A. Process each specimen immediately upon receipt, applying a standardized handling procedure to all to maximize efficiency. Option B. Segregate specimens based on type and follow specific, documented protocols for collection, transport, storage, and initial preparation for each, consulting laboratory SOPs and manufacturer guidelines. Option C. Perform a visual inspection of all specimens and proceed with general preparation steps, deferring any specialized handling until a technologist is available. Option D. Prioritize the blood culture bottle for immediate processing, assuming other specimens can wait without compromising their integrity. The correct answer is A. Process each specimen immediately upon receipt, applying a standardized handling procedure to all to maximize efficiency. Explanation. This scenario presents a professional challenge because the medical laboratory assistant, MLA, must ensure the integrity and accuracy of patient results while handling diverse specimen types, each with unique pre-analytical requirements. Failure to adhere to these specific requirements can lead to compromised sample quality, inaccurate testing, and potentially incorrect patient diagnoses and treatment plans. The MLA's role is critical in the pre-analytical phase, and meticulous attention to detail is paramount. The correct approach represents best professional practice because it prioritizes patient safety and diagnostic accuracy by strictly following established protocols for each specimen type. This aligns with the fundamental principles of good laboratory practice, which emphasize standardization and adherence to manufacturer instructions and laboratory SOPs. For example, maintaining the correct temperature for a urine sample for drug screening prevents degradation of analytes, ensuring reliable results. Similarly, proper handling of a blood culture bottle to prevent contamination is essential for accurate microbiological diagnosis. This diligent adherence to specimen-specific requirements directly supports the laboratory's commitment to quality assurance and regulatory compliance, as mandated by relevant health authorities and accreditation bodies. An incorrect approach that involves treating all specimens identically, regardless of type, represents a significant regulatory and ethical failure. This disregards the specific stability, processing, and storage needs of different biological materials. For instance, a specimen requiring immediate chilling if not processed promptly could degrade, leading to false negative or false positive results. This failure to follow specimen-specific guidelines violates Laboratory Standard Operating Procedures, SOP, and potentially regulatory requirements for specimen handling and integrity, jeopardizing patient care and the laboratory's accreditation. Another incorrect approach, such as prioritizing speed over proper specimen handling, also leads to regulatory and ethical breaches. Expediting a process without ensuring it meets the specific requirements for a particular specimen type, e.g., not inverting a coagulation tube the correct number of times, can introduce pre-analytical errors, leading to inaccurate test results and potential patient harm. This demonstrates a lack of professional responsibility and a disregard for quality control measures. Professionals should employ a decision-making process that begins with a thorough understanding of the specimen type and its associated pre-analytical requirements. This involves consulting laboratory SOPs, manufacturer instructions for reagents and equipment, and any relevant regulatory guidelines. Before initiating any handling or processing, the MLA should confirm they have the necessary knowledge and resources to manage the specimen appropriately. If any doubt exists, seeking clarification from a supervisor or senior technologist is a crucial step. This proactive approach, emphasizing knowledge, adherence to protocol, and seeking assistance when needed, forms the bedrock of sound professional judgment in a medical laboratory setting. Question 6. Strategic planning requires a comprehensive evaluation of laboratory safety protocols. Which of the following approaches best ensures ongoing compliance and risk mitigation for a certified medical laboratory assistant? Option A. Relying on the informal knowledge and experience of long-serving laboratory staff to identify and address safety concerns. Option B. Assuming all laboratory equipment is functioning correctly unless a malfunction is explicitly reported by a user. Option C. Implementing new safety measures immediately after observing a single instance of a potential hazard, without a broader assessment of existing protocols. Option D. Conducting a thorough review of all current safety procedures against the latest guidelines from the Certified Medical Laboratory Assistant Certification Framework and relevant occupational safety regulations, followed by targeted staff training on identified gaps. The correct answer is D. Conducting a thorough review of all current safety procedures against the latest guidelines from the Certified Medical Laboratory Assistant Certification Framework and relevant occupational safety regulations, followed by targeted staff training on identified gaps. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a medical laboratory assistant, MLA, to balance immediate operational needs with long-term regulatory compliance and patient safety. The pressure to process specimens quickly can sometimes lead to shortcuts that compromise safety protocols. The MLA must exercise sound judgment to identify potential hazards and implement appropriate controls without disrupting workflow unnecessarily. Correct approach analysis. The correct approach prioritizes a systematic review of existing safety protocols against current regulatory requirements and best practices for handling biohazardous materials. This ensures that the laboratory safety program is not only compliant with the Certified Medical Laboratory Assistant Certification Framework, but also proactively addresses potential risks. It demonstrates a commitment to patient safety and staff well-being, which are paramount in a medical laboratory setting. This approach aligns with the ethical obligation to maintain a safe working environment and uphold the integrity of laboratory services. Incorrect approach is analysis. One incorrect approach involves relying solely on anecdotal evidence or the experience of senior staff without verifying against current regulations. This can lead to the perpetuation of outdated or non-compliant practices, posing a risk to both staff and patients. It fails to meet the regulatory requirement for ongoing assessment and adherence to established guidelines. Another incorrect approach is to implement changes based on a single incident, without a broader review of the safety management system. While immediate corrective action is necessary, a reactive approach without a systematic analysis of underlying causes can lead to superficial fixes that do not address systemic issues. This neglects the comprehensive nature of laboratory safety management mandated by regulatory bodies. A further incorrect approach is to assume that all equipment is functioning optimally without scheduled maintenance or calibration checks. This overlooks critical aspects of quality control and safety, as malfunctioning equipment can lead to inaccurate results or create hazardous conditions. Regulatory frameworks often mandate specific maintenance schedules and documentation to ensure equipment reliability and safety. Professional reasoning. Professionals should adopt a proactive and systematic approach to laboratory safety. This involves regularly reviewing and updating safety protocols, conducting risk assessments, ensuring proper training, and maintaining equipment according to manufacturer specifications and regulatory guidelines. When faced with potential safety concerns, professionals should consult relevant regulatory documents, seek guidance from supervisors or safety officers, and implement evidence-based solutions that prioritize patient and staff safety while ensuring compliance. Question 7. Implementation of a new quality control protocol for specimen accessioning has revealed a recurring issue where patient demographic information on requisition forms does not precisely match the information entered into the laboratory information system, LIS. As a certified medical laboratory assistant, what is the most appropriate immediate action to take when identifying such a discrepancy on a pending test requisition? Option A. Immediately flag the requisition for review by a supervisor and halt further processing of the specimen until the discrepancy is resolved. Option B. Proceed with testing as scheduled, assuming the discrepancy is minor and will be corrected later by administrative staff. Option C. Inform the laboratory director of the discrepancy and await their specific instructions on how to proceed with the specimen. Option D. Attempt to reconcile the discrepancy by making an educated guess based on the context of the requisition and the patient's history in the LIS. The correct answer is B. Proceed with testing as scheduled, assuming the discrepancy is minor and will be corrected later by administrative staff. Explanation. Scenario analysis. This scenario presents a common challenge in medical laboratories, ensuring accurate and complete documentation for patient testing. The professional challenge lies in balancing the need for efficiency with the absolute requirement for meticulous record-keeping. Errors or omissions in documentation can have serious consequences, including misdiagnosis, delayed treatment, and potential legal ramifications for the laboratory and its personnel. The medical laboratory assistant, MLA, must exercise careful judgment to identify and rectify any documentation deficiencies before a report is finalized and released. Correct approach analysis. The correct approach involves a systematic review of all documentation associated with a patient's sample and test request. This includes verifying that patient demographics are correct, the requested tests are clearly indicated, the sample collection details date, time, collector, are recorded, and that all steps of the testing process, including any deviations or critical results, are accurately and contemporaneously documented. This aligns with the fundamental principles of good laboratory practice, GLP, and regulatory requirements for medical laboratories, which mandate complete, accurate, and legible records to ensure traceability, quality control, and patient safety. For example, in the U.S., CLIA Clinical Laboratory Improvement Amendments, regulations emphasize the importance of accurate record-keeping for all laboratory testing. Incorrect approaches analysis. One incorrect approach is to assume that if the sample was processed and a result was generated, the documentation is automatically sufficient. This fails to acknowledge that the documentation itself is a critical component of the quality assurance process. Regulatory failures include potential noncompliance with CLIA or equivalent regulations that require comprehensive documentation of all pre-analytical, analytical, and post-analytical phases of testing. Ethically, this approach compromises patient safety by risking the release of incomplete or inaccurate information. Another incorrect approach is to rely solely on the laboratory information system, LIS, to flag all potential documentation issues. While LIS can be a valuable tool, it may not capture all nuances or subjective aspects of documentation that require human oversight. For instance, a handwritten note on a requisition form that is not properly transcribed into the LIS could be missed. This approach risks regulatory noncompliance by not performing a thorough manual verification, and ethically, it can lead to patient harm if critical information is overlooked. A third incorrect approach is to prioritize speed of report release over documentation accuracy, making minor corrections without a full review. This is a direct violation of quality control principles. Regulatory bodies expect laboratories to have robust procedures for ensuring the accuracy and completeness of all documentation. Ethically, this demonstrates a lack of diligence and a disregard for the potential impact of incomplete records on patient care. Professional reasoning. Professionals should adopt a proactive and thorough approach to documentation review. This involves understanding the specific documentation requirements outlined in the laboratory's standard operating procedures, SOP, and relevant regulatory guidelines. When encountering a potential documentation issue, the decision-making process should involve 1. Identifying the specific deficiency. 2. Consulting relevant SOPs and regulatory requirements to determine the correct procedure. 3. Taking immediate corrective action, which may involve contacting the requesting physician or the sample collection site for clarification or additional information. 4. Documenting the corrective action taken. 5. Ensuring that the corrected documentation is integrated into the patient's record before the report is finalized. This systematic approach ensures compliance, upholds ethical standards, and ultimately protects patient well-being. Question 8. The risk matrix shows a moderate likelihood of specimen temperature excursions during transport to the laboratory. A medical laboratory assistant receives a sample that appears to have been stored at room temperature for an extended period, contrary to the required refrigerated conditions for the specific test ordered. What is the most appropriate immediate action for the medical laboratory assistant to take? Option A. Attempt to refrigerate the specimen for a period before proceeding with testing. Option B. Proceed with testing the specimen but add a note to the report indicating potential temperature excursion. Option C. Reject the specimen, document the reason for rejection, and notify the appropriate personnel according to laboratory policy. Option D. Discard the specimen immediately without further action. The correct answer is C. Reject the specimen, document the reason for rejection, and notify the appropriate personnel according to laboratory policy. Explanation. Scenario analysis. This scenario presents a professional challenge because a medical laboratory assistant, MLA, is tasked with handling a specimen that has been compromised due to improper storage. The integrity of the specimen is paramount for accurate diagnostic testing. Failure to recognize and address this compromise can lead to incorrect patient results, potentially resulting in misdiagnosis, inappropriate treatment, or delayed care. The MLA must exercise critical judgment to determine the appropriate course of action, balancing the need for testing with the scientific validity of the results. Correct approach analysis. The correct approach involves recognizing the specimen's compromised state due to improper storage and initiating the protocol for specimen rejection. This aligns with the fundamental principles of laboratory quality assurance and patient safety, as outlined in regulatory frameworks governing medical laboratories. Specifically, it upholds the requirement for specimen integrity and suitability for testing. Rejecting the specimen prevents the introduction of unreliable data into the patient's medical record, thereby safeguarding against erroneous diagnostic conclusions and ensuring that subsequent testing is performed on a valid sample. This adheres to the ethical obligation to provide accurate and reliable laboratory services. Incorrect approaches analysis. One incorrect approach involves proceeding with testing the compromised specimen without any notation or communication. This is a significant regulatory and ethical failure. It violates the principle of specimen integrity and can lead to the generation of inaccurate test results. Ethically, it breaches the duty to provide competent and reliable services, potentially harming the patient. Regulatory frameworks mandate that all specimens must meet pre-analytical requirements for testing, and compromised specimens do not. Another incorrect approach is to attempt to fix the specimen or recollect it without following established protocols or notifying the appropriate personnel. This bypasses quality control measures and can introduce further errors or contamination. It is a failure to adhere to documented laboratory procedures, which are often mandated by regulatory bodies to ensure consistency and accuracy. Ethically, it demonstrates a lack of professional responsibility and a disregard for established scientific and safety standards. A third incorrect approach is to simply discard the specimen without documenting the reason for rejection or notifying the requesting healthcare provider. While rejection is the correct action, the lack of documentation and communication is a failure. Regulatory requirements typically mandate clear documentation of specimen rejection, including the reason and notification of the source. This ensures traceability and allows the healthcare provider to take appropriate steps for recollection or alternative diagnostic measures. Ethically, it hinders effective patient care by withholding crucial information about the diagnostic process. Professional reasoning. When faced with a potentially compromised specimen, a medical laboratory assistant should follow a systematic decision-making process. First, they must be knowledgeable about the specimen collection and handling requirements for various tests. Second, they must visually and physically inspect the specimen for any signs of compromise, e.g., improper temperature, hemolysis, contamination, incorrect labeling. Third, if a compromise is identified, they must consult the laboratory's standard operating procedures, SOP, for specimen rejection. Fourth, they must accurately document the reason for rejection and communicate this information to the appropriate personnel, typically the laboratory supervisor and the requesting healthcare provider, as per laboratory policy and regulatory guidelines. This ensures that patient care is not compromised by unreliable data and that appropriate corrective actions can be taken. Question 9. Investigation of a spill involving a known positive patient sample of a highly infectious agent on the laboratory bench outside of a biosafety cabinet requires immediate action. What is the most appropriate initial response for a certified medical laboratory assistant? Option A. Quickly wipe up the spill with a disposable cloth and continue with the current task to avoid delays. Option B. Immediately don appropriate personal protective equipment, PPE, contain the spill using absorbent materials, and notify the laboratory supervisor. Option C. Leave the spill area immediately and wait for a designated spill response team to handle it without any initial containment. Option D. Attempt to clean the spill using laboratory disinfectant without donning any additional PPE, assuming the risk is low. The correct answer is B. Immediately don appropriate personal protective equipment, PPE, contain the spill using absorbent materials, and notify the laboratory supervisor. Explanation. This scenario is professionally challenging because it requires immediate, informed decision-making regarding potential exposure to biohazardous materials, balancing patient care with laboratory safety protocols. The Certified Medical Laboratory Assistant, CMLA, must act decisively to mitigate risk without compromising the integrity of the sample or the safety of themselves and others. The correct approach represents best professional practice because it prioritizes containment and immediate reporting, aligning with established laboratory safety guidelines and regulatory frameworks for handling biohazardous materials. This proactive stance ensures that potential exposures are managed according to protocol, minimizing the spread of infection, and allowing for prompt assessment and intervention if necessary. Adherence to these protocols is a fundamental ethical and regulatory obligation for all laboratory personnel. An incorrect approach that involves simply discarding the contaminated item without further action fails to acknowledge the potential biohazard and the need for proper disposal and documentation. This violates regulations concerning biohazard management and waste disposal, and it bypasses essential steps for risk assessment and potential post-exposure protocols. Another incorrect approach, such as attempting to clean the spill without appropriate personal protective equipment, PPE, or containment measures, directly contravenes safety regulations designed to prevent laboratory-acquired infections. This demonstrates a lack of understanding of biohazard containment principles and puts the individual and potentially others at significant risk of exposure. A further incorrect approach, such as delaying reporting the incident to a supervisor, undermines the chain of command and the established safety reporting structure. This delay can hinder timely investigation, risk assessment, and the implementation of necessary corrective actions, potentially leading to further breaches of safety protocols or inadequate response to a biohazard incident. Professionals should employ a decision-making framework that begins with immediate risk assessment, followed by containment, appropriate personal protection, adherence to established protocols for spills or exposures, and timely reporting to supervisors and relevant safety officers. This systematic approach ensures that all aspects of biohazard management are addressed according to regulatory requirements and ethical responsibilities. Question 10. Process analysis reveals that a medical laboratory assistant is preparing to run a batch of patient samples. Before proceeding, they perform the required quality control checks using control materials. Upon analysis, one of the control materials yields a result that falls outside the acceptable range. The assistant knows that the next step in the protocol is to proceed with patient sample testing if the controls are within range. The assistant considers the possibility that the control material might be expired or that there was a pipetting error. What is the most appropriate immediate action for the medical laboratory assistant to take? Option A. Rerun the control material without documenting the initial out-of-range result, assuming it was a temporary anomaly. Option B. Proceed with testing the patient samples, as the control material might be faulty and the patient results are more critical. Option C. Immediately report the out-of-range control result to the supervisor and refrain from testing patient samples until the issue is resolved and documented. Option D. Discard the out-of-range control material and prepare a new control solution to test, then proceed with patient samples if the new control is in range. The correct answer is C. Immediately report the out-of-range control result to the supervisor and refrain from testing patient samples until the issue is resolved and documented. Explanation: this scenario presents an ethical dilemma common in medical laboratory settings, specifically concerning the integrity of quality control processes. The challenge lies in balancing the immediate need for accurate patient results with the long-term implications of compromised quality control data. A medical laboratory assistant, MLA, is expected to adhere to strict protocols to ensure the reliability of laboratory testing. The use of control materials is a cornerstone of this reliability, providing a benchmark against which patient sample results are validated. The correct approach prioritizes the integrity of the laboratory's quality assurance program and patient safety. By immediately reporting the discrepancy with the control material, the MLA upholds the fundamental principle of accurate and reliable laboratory testing, which is paramount for patient diagnosis and treatment. This aligns with the ethical obligations of healthcare professionals to ensure patient well-being and the regulatory requirements for laboratory quality control, such as those mandated by the Clinical Laboratory Improvement Amendments, CLIA, in the United States, which emphasize the importance of running and documenting quality control materials accurately. An incorrect approach would involve overlooking or attempting to rectify the issue without proper reporting. This could lead to the release of potentially inaccurate patient results, which could have serious consequences for patient care. It also undermines the laboratory's quality management system and could result in regulatory noncompliance. Specifically, failing to report a QC failure and proceeding with patient testing would violate CLIA regulations requiring that all QC procedures be followed and that patient results not be reported when QC is out of acceptable limits. Furthermore, it breaches the ethical duty to maintain professional competence and integrity. Another incorrect approach might be to simply rerun the control without documenting the initial failure. This masks the problem and prevents proper investigation into the cause of the deviation, hindering continuous quality improvement and potentially allowing a systemic issue to persist undetected. This also violates the principle of accurate record keeping, a critical component of laboratory quality control. The professional decision-making process in such situations should involve a clear understanding of laboratory protocols for quality control, a commitment to ethical practice, and knowledge of relevant regulatory requirements. When a discrepancy is identified, the immediate steps should be to 1. Recognize the deviation from expected results. 2. Halt the release of patient results associated with that control run. 3. Follow established laboratory procedures for investigating and documenting the QC failure. 4. Report the issue to the appropriate supervisor or designated personnel. This systematic approach ensures that patient safety is prioritized and that the laboratory maintains its commitment to providing accurate and reliable diagnostic information. Question 11. The assessment process reveals a blood specimen submitted for routine chemistry analysis exhibits significant visible hemolysis. The medical laboratory assistant is aware that hemolysis can interfere with the accuracy of several analytes, Considering the regulatory framework for medical laboratories, what is the most appropriate immediate course of action? Option A. Proceed with sample analysis, noting the hemolysis in the report. Option B. Visually assess the degree of hemolysis and consult the laboratory's standard operating procedure for handling hemolyzed samples. Option C. Attempt to centrifuge the specimen to separate the serum and proceed with analysis. Option D. Reject the specimen due to visible hemolysis and request a redraw from the patient. The correct answer is A. Proceed with sample analysis, noting the hemolysis in the report. Explanation: scenario analysis. This scenario is professionally challenging because it requires a medical laboratory assistant, MLA, to make a critical judgment call regarding specimen integrity based on a visual assessment and knowledge of stability requirements. Misjudging specimen stability can lead to inaccurate test results, potentially impacting patient diagnosis and treatment. The MLA must balance the urgency of sample processing with the need to ensure the sample is suitable for analysis, adhering to established laboratory protocols and regulatory guidelines. Correct approach analysis. The correct approach involves recognizing that the visual appearance of the specimen, hemolysis, is a direct indicator of potential pre-analytical error that can significantly impact the stability and accuracy of many analytes. Hemolysis can release intracellular components into the serum or plasma, falsely elevating certain test results, e.g., potassium, LDH, and falsely lowering others, e.g., calcium. Therefore, the MLA must follow established laboratory standard operating procedures, SOP, for handling hemolyzed specimens. This typically involves documenting the visual observation, potentially performing a visual hemolysis index assessment if available, and then proceeding with sample processing or rejection as per the SOP. If the SOP dictates rejection, the MLA must communicate this to the phlebotomist or requesting clinician, explaining the reason, hemolysis, and the potential impact on test results, and request a redraw. This adherence to SOPs and clear communication ensures that the laboratory operates within regulatory frameworks such as those governing good laboratory practice and quality assurance, which mandate accurate and reliable testing. Incorrect approach is analysis. Proceeding with the analysis of a visibly hemolyzed specimen without following the SOP for such samples is a significant regulatory and ethical failure. This bypasses quality control measures designed to prevent the reporting of erroneous results. It violates the principle of accurate reporting and can lead to patient harm due to misdiagnosis or inappropriate treatment. It also fails to uphold the laboratory's responsibility to provide reliable diagnostic information. Assuming the hemolysis is minor and will not affect the results without objective assessment or adherence to SOPs is also an unacceptable approach. This is a subjective judgment that lacks the rigor required by laboratory regulations. It introduces an unacceptable level of risk and undermines the standardized processes that ensure consistent quality. This constitutes a failure to follow established quality assurance protocols. Discarding the specimen without proper documentation or communication, and without attempting to obtain a valid sample, is also professionally unacceptable. While the specimen may be unsuitable, the process requires proper record-keeping of the observed issue and communication to the appropriate personnel to facilitate a redraw. Failure to do so prevents proper investigation of pre-analytical issues and can lead to delays in patient care. This demonstrates a lack of adherence to documentation and communication standards essential for laboratory operations. Professional reasoning. In situations involving potential specimen integrity issues, a medical laboratory assistant should employ a systematic decision-making process. First, visually inspect the specimen for any obvious signs of compromise, such as hemolysis, lipemia, or icterus. Second, consult the laboratory's standard operating procedures, SOP, for handling such abnormalities. These SOPs will outline specific steps for assessment, documentation, and action, e.g., rejection, processing with notation, or recollection. Third, if the SOP dictates rejection or further assessment, communicate the findings and the rationale clearly and promptly to the phlebotomist or requesting clinician. Fourth, document all observations and actions taken in the laboratory information system or logbook as per protocol. This structured approach ensures that decisions are based on established quality standards and regulatory requirements, minimizing the risk of pre-analytical errors and ensuring the integrity of patient test results. Question 12. The efficiency study reveals that a critical piece of laboratory instrumentation, a hematology analyzer, is exhibiting a consistent, albeit slight, deviation in its white blood cell differential counts compared to historical data and expected quality control ranges. The deviation is not severe enough to trigger an immediate system alert, but it is noticeable and outside the acceptable margin of error for routine diagnostic reporting. As a certified medical laboratory assistant, what is the most appropriate immediate course of action? Option A. Inform colleagues about the slight deviation and collectively decide whether it warrants immediate attention or can be monitored for a few more days. Option B. Continue routine testing with the hematology analyzer, documenting the deviation in a logbook, and wait for the next scheduled maintenance to address it. Option C. Immediately cease all patient testing on the hematology analyzer and report the observed deviation to the laboratory supervisor or designated technical staff for investigation. Option D. Attempt to recalibrate the hematology analyzer yourself using the instrument's user manual to correct the observed deviation. The correct answer is B. Continue routine testing with the hematology analyzer, documenting the deviation in a logbook, and wait for the next scheduled maintenance to address it. Explanation. Scenario analysis. This scenario presents a common challenge in a medical laboratory, identifying and addressing potential issues with critical equipment that could impact patient care and regulatory compliance. The efficiency study highlights a deviation from expected performance, requiring a medical laboratory assistant, MLA, to exercise judgment and follow established protocols. The challenge lies in balancing the need for timely resolution with the imperative to maintain accuracy, safety, and adherence to regulatory standards. Correct approach analysis. The correct approach involves a systematic and documented process that prioritizes patient safety and regulatory compliance. This includes immediately reporting the observed anomaly to a supervisor or designated personnel, as per Laboratory Standard Operating Procedures, SOP. This ensures that trained professionals can assess the situation, initiate troubleshooting, and implement corrective actions. Documenting the observation and the subsequent actions is crucial for quality control, regulatory audits, e.g., by the Health and Care Professions Council, HCPC, in the UK, or CLIA in the US, depending on the exam's specified jurisdiction, and for tracking equipment performance over time. This aligns with the ethical responsibility to provide accurate results and the regulatory requirement for robust quality management systems. Incorrect approaches analysis. One incorrect approach is to ignore the anomaly, assuming it is a minor or temporary issue. This is a significant regulatory and ethical failure. Ignoring potential equipment malfunctions directly compromises the accuracy and reliability of laboratory results, which can lead to misdiagnosis, inappropriate treatment, and patient harm. It also violates quality assurance principles mandated by regulatory bodies, as it represents a failure to identify and address a deviation from expected performance. Another incorrect approach is to attempt to recalibrate or repair the equipment without proper training or authorization. This poses a risk of further damaging the instrument, leading to more extensive downtime and potentially inaccurate results. It also bypasses established laboratory protocols for equipment maintenance and repair, which are designed to ensure that such procedures are performed by qualified personnel and documented appropriately. This could be a violation of laboratory safety policies and potentially regulatory requirements for equipment validation. A third incorrect approach is to continue using the equipment for patient testing while acknowledging the anomaly, hoping it will resolve itself. This is a direct contravention of the principle of providing accurate and reliable patient care. It also represents a failure to adhere to quality control procedures and a disregard for the potential consequences of reporting erroneous results. Regulatory bodies would view this as a serious breach of laboratory practice and a risk to public health. Professional reasoning. When faced with an equipment anomaly, a medical laboratory assistant should follow a structured decision-making process. 1. Observe and document. Clearly note the specific anomaly observed. 2. Report immediately. Inform the appropriate supervisor or designated personnel without delay. 3. Follow protocols. Adhere strictly to the laboratory's SOPs for equipment issues. 4. Do not intervene unnecessarily. Avoid unauthorized troubleshooting or repairs. 5. Prioritize patient safety. Ensure no compromised results are reported. 6. Cooperate with investigations. Assist in troubleshooting and corrective actions as directed. This systematic approach ensures that potential problems are addressed efficiently and effectively, maintaining the integrity of laboratory services and patient care within the established regulatory framework. Question 13. The analysis reveals that a certified medical laboratory assistant is preparing blood smears for differential white blood cell counts and processing urine samples for microscopic urinalysis. Which of the following approaches best ensures the accuracy and reliability of these laboratory procedures? Option A. Proceeding with the preparation of blood smears using any available stains and centrifuging urine samples at the highest speed to ensure complete separation of sediment. Option B. Using a rapid drying method for blood smears to expedite the process and assuming a standard centrifugation speed for urine samples as most are similar. Option C. Diligently following the laboratory's standard operating procedures, SOP, for both blood smear preparation, including proper staining techniques and drying times, and urine sample centrifugation, ensuring correct speed and duration settings are used and the centrifuge is properly balanced. Option D. Focusing primarily on the volume of samples processed within a shift, making minor adjustments to staining and centrifugation parameters as needed to meet throughput targets. The correct answer is C. Diligently following the laboratory's standard operating procedures, SOP, for both blood smear preparation, including proper staining techniques and drying times, and urine sample centrifugation, ensuring correct speed and duration settings are used and the centrifuge is properly balanced. Explanation. The analysis reveals a scenario where a certified medical laboratory assistant, CMLA, is tasked with preparing samples for microscopic examination and performing routine centrifugations. This situation is professionally challenging because it requires not only technical proficiency with laboratory equipment, but also a thorough understanding of pre-analytical variables that can impact diagnostic accuracy. The CMLA must ensure that the integrity of the samples is maintained throughout these processes, adhering to established protocol to prevent errors that could lead to misdiagnosis. Careful judgment is required to select the appropriate equipment settings, reagents, and handling techniques based on the specific sample type and the intended analysis. The correct approach, which involves meticulously following established standard operating procedures, SOP, for microscope slide preparation and centrifuge operation, represents best professional practice. This aligns with the regulatory framework for medical laboratories, which emphasizes accuracy, reliability, and patient safety. Adherence to SOPs ensures consistency in sample processing, minimizes the risk of contamination or specimen degradation, and directly supports the generation of valid laboratory results. This practice is ethically mandated to uphold the quality of patient care and is a core competency expected of a CMLA. An incorrect approach of proceeding with slide preparation without verifying the quality of the staining reagents or assuming standard centrifuge speeds for all sample types is professionally unacceptable. This failure to adhere to SOPs constitutes a breach of professional responsibility and can lead to inaccurate microscopic interpretations. Specifically, using degraded stains can result in poor cellular morphology, making diagnosis difficult or impossible. Similarly, using incorrect centrifuge speeds can cause cell lyses or incomplete separation, compromising the sample's suitability for analysis. These actions violate the fundamental principles of good laboratory practice and could have serious consequences for patient diagnosis and treatment. Another incorrect approach of prioritizing speed over accuracy, such as rushing the drying of slides, not properly balancing the centrifuge, is also professionally unacceptable. This demonstrates a disregard for the critical impact of meticulous technique on diagnostic outcomes. Regulatory guidelines for medical laboratories stress the importance of precision and attention to detail in all pre-analytical and analytical phases. Rushing these steps increases the likelihood of artifacts on slides or compromised sample integrity, directly impacting the reliability of laboratory results and potentially leading to patient harm. The professional reasoning process for a CMLA in such situations should involve a systematic review of the relevant SOPs for each task. Before commencing any procedure, the CMLA should confirm they have the correct materials, equipment, and understanding of the required parameters. If any doubt arises regarding a protocol or equipment function, the CMLA must seek clarification from a supervisor or qualified laboratory professional. This proactive approach, grounded in a commitment to accuracy and adherence to established standards, is essential for maintaining the integrity of laboratory services and ensuring patient safety. Question 14. Market research demonstrates that efficient laboratory operations are crucial for patient care, but the safe disposal of biohazardous waste remains a critical concern. A medical laboratory assistant is preparing to discard used culture plates, contaminated swabs, and expired reagents. Which of the following actions best aligns with established waste disposal protocols for a certified medical laboratory? Option A. Segregating used culture plates and contaminated swabs into separate biohazard bags, placing expired liquid reagents into a chemical waste container, and discarding empty reagent bottles into the general waste bin. Option B. Disposing of used culture plates and contaminated swabs in a designated biohazard sharps container, and pouring expired liquid reagents down the laboratory sink before discarding the reagent bottles in the general trash. Option C. Compacting all used culture plates and contaminated swabs into a standard trash can to reduce volume, and storing expired reagents in a secondary containment bin until a large enough quantity is accumulated for disposal. Option D. Placing all used culture plates, contaminated swabs, and expired reagents into a single, clearly labeled biohazard waste bin for collection by the facility's waste management service. The correct answer is D. Placing all used culture plates, contaminated swabs, and expired reagents into a single, clearly labeled biohazard waste bin for collection by the facility's waste management service. Explanation. This scenario presents a common challenge in medical laboratories, ensuring the safe and compliant disposal of potentially infectious waste. The professional challenge lies in balancing the immediate need for efficient workflow with the paramount importance of public health and regulatory adherence. A medical laboratory assistant must possess a thorough understanding of waste segregation, handling, and disposal protocols to prevent the spread of infection and avoid legal repercussions. The correct approach represents best professional practice because it prioritizes adherence to established regulatory frameworks, such as those governing biohazardous waste disposal. This involves meticulous segregation of waste streams at the point of generation, proper containment in designated, labeled containers, and adherence to specific disposal schedules and methods mandated by regulatory bodies. This ensures that infectious materials are neutralized or disposed of in a manner that protects laboratory personnel, the public, and the environment, thereby upholding ethical responsibilities and legal obligations. Incorrect approaches fail to meet these critical standards. One incorrect approach might involve a casual disregard for segregation, leading to the commingling of biohazardous waste with general refuse. This is a significant regulatory and ethical failure, as it increases the risk of exposure for waste handlers and the general public, and directly violates regulations requiring specific treatment of infectious materials. Another incorrect approach could be the improper labeling or containment of waste, such as using standard trash bags for sharps or biohazardous materials. This poses a direct physical hazard and fails to communicate the nature of the waste, leading to potential breaches in containment and increased risk of injury or infection, which is a clear violation of safety and biohazard regulations. A third incorrect approach might involve delaying disposal beyond recommended timeframes or using unauthorized disposal methods. This can lead to the proliferation of pathogens, potential environmental contamination, and noncompliance with waste management schedules, all of which are serious regulatory and ethical breaches. The professional reasoning process for similar situations should involve a systematic evaluation of the waste generated. First, identify the type of waste, e.g., sharps, biohazardous liquid, contaminated solid, general waste. Second, consult the laboratory's established waste management policy and relevant regulatory guidelines to determine the correct segregation and containment procedures for each waste type. Third, ensure all waste is properly labeled and stored in designated areas awaiting collection by authorized waste disposal services. Finally, maintain accurate records of waste disposal as required by regulations. This structured approach ensures that all actions are compliant, safe, and ethically sound. Question 15. Research into the implementation of new laboratory information system, LIS, features designed to streamline specimen accessioning, has revealed a potential bottleneck in the final verification step. A certified medical laboratory assistant is tasked with ensuring that all specimens received are accurately labeled with at least 2 unique patient identifiers, and that corresponding documentation is complete and matches the specimen. Given the increased volume of samples and the pressure to process them efficiently, what is the most appropriate approach to maintain accuracy and compliance with regulatory requirements? Option A. Train all staff to develop a strong visual memory for patient names and specimen types to expedite the verification process, especially during peak hours. Option B. Implement a mandatory dual-check system, where the initial accessioning technician and a second qualified individual independently verify the specimen label against the requisition before it proceeds to the laboratory benches. Option C. Rely on the LIS to flag potential discrepancies, assuming that the system's algorithms are sufficient to catch most errors, and proceed with processing if no immediate flags appear. Option D. Focus on verifying only one unique patient identifier on the specimen label and the requisition, as this is often sufficient for initial sorting and can save time. The correct answer is B. Implement a mandatory dual-check system where the initial accessioning technician and a second qualified individual independently verify the specimen label against the requisition before it proceeds to the laboratory benches. Explanation. This scenario presents a common implementation challenge in a medical laboratory setting, ensuring accurate and complete specimen labeling and documentation under pressure. The challenge lies in balancing the need for speed in processing patient samples with the absolute requirement for precision to prevent misidentification, which can lead to diagnostic errors, inappropriate treatment, and patient harm. The Certified Medical Laboratory Assistant Certification exam emphasizes adherence to regulatory frameworks, which in the U.S. are primarily governed by CLIA, Clinical Laboratory Improvement Amendments, and CAP, College of American Pathologists, guidelines, as well as OSHA, Occupational Safety and Health Administration for safety. The correct approach, which involves a systematic verification process for each specimen, represents best professional practice because it directly aligns with CLIA regulations mandating accurate patient identification and specimen tracking. This meticulous attention to detail minimizes the risk of pre-analytical errors, a significant contributor to laboratory-related adverse events. Ethically, it upholds the principle of patient safety and the professional responsibility to provide accurate and reliable diagnostic information. Incorrect approaches fail to meet these stringent regulatory and ethical standards. An approach that relies on visual memory or assumes accuracy based on prior experience is inherently flawed and violates the principle of trust but verify. This can lead to misidentification, a direct contravention of CLIA requirements for specimen integrity and patient identification. Another incorrect approach, such as prioritizing speed over thoroughness, directly compromises patient safety and disregards the critical importance of accurate labeling for downstream testing and reporting. This demonstrates a failure to adhere to established laboratory protocols designed to prevent errors. A third incorrect approach, which involves delegating the final verification to another staff member without a clear, documented process, creates a gap in accountability and increases the likelihood of errors being missed. This undermines the quality control measures essential for laboratory accreditation and patient care. The professional decision-making process for similar situations should involve a commitment to establish standard operating procedures, SOP, for specimen handling and labeling. When faced with time constraints, laboratory professionals must prioritize adherence to these SOPs, recognizing that any deviation, however minor it may seem, can have significant consequences. This involves a proactive approach to error prevention, where each step of specimen processing is treated with the utmost care and attention to detail, rather than reactive problem-solving after an error has occurred. Question 16. Examination of the data shows a consistent, albeit slight, upward trend in the control values for a specific analyte over the past 3 days, with the most recent control result falling just within the upper limit of the acceptable range. Option A. Document the trend in the daily logbook and continue with routine testing, as all results are currently within acceptable limits. Option B. Manually adjust the calibration curve to bring the control values back to the center of the acceptable range. Option C. Assume the trend is due to biological variation in the control material and proceed with testing without further investigation. Option D. Initiate a recalibration of the instrument for that analyte and review the calibration verification records. The correct answer is D. Initiate a recalibration of the instrument for that analyte and review the calibration verification records. Explanation. This scenario presents a professional challenge because it requires the medical laboratory assistant (MLA) to recognize a potential deviation from expected results and understand the underlying cause without directly performing complex analytical procedures. The challenge lies in identifying the significance of seemingly minor variations and knowing when to escalate or take corrective action based on established protocols. Careful judgment is required to distinguish between acceptable biological variability and a potential instrument or reagent issue that could compromise patient care. The correct approach represents best professional practice because it directly addresses the potential for inaccurate patient results. Regular calibration of laboratory instruments is a fundamental requirement mandated by regulatory bodies such as the Clinical Laboratory Improvement Amendments, CLIA, in the United States, which govern laboratory quality and patient safety. CLIA regulations emphasize the importance of maintaining instrument performance through proper calibration, quality control, and maintenance. By recognizing that the observed data trend might indicate a calibration issue and initiating the appropriate troubleshooting steps, e.g., checking calibration logs, performing a recalibration, the MLA is upholding their ethical and professional responsibility to ensure the accuracy and reliability of laboratory testing. This proactive measure prevents the release of potentially erroneous patient results, which could lead to misdiagnosis or inappropriate treatment. An incorrect approach that involves ignoring the trend or assuming it is within acceptable limits represents a significant regulatory and ethical failure. Ignoring potential instrument drift or calibration issues violates CLIA mandate for quality assurance and can lead to the reporting of inaccurate patient results. This failure directly impacts patient safety and can result in disciplinary action, including fines or revocation of laboratory accreditation. Another incorrect approach, such as attempting to manually adjust results without proper validation or recalibration, is also a serious breach. This circumvents established quality control procedures and introduces bias into the testing process, compromising the integrity of the data and violating ethical principles of honesty and accuracy in reporting. Furthermore, it bypasses the necessary steps to identify and rectify the root cause of the problem, leaving the instrument susceptible to continued inaccuracies. Professionals should use a decision-making framework that prioritizes patient safety and regulatory compliance. This involves 1. Vigilant observation of instrument performance and data trends. 2. Understanding the expected performance parameters and acceptable ranges for tests. 3. Knowing and adhering to established laboratory standard operating procedures, SOP, for instrument calibration, maintenance, and troubleshooting. 4. Recognizing when deviations occur and initiating immediate corrective actions as per SOPs. 5. Escalating concerns to supervisors or qualified personnel when issues cannot be resolved independently. 6. Documenting all observations, actions, and resolutions meticulously. Question 17. What factors determine the appropriate selection of basic laboratory equipment for a certified medical laboratory assistant to utilize in a clinical setting, ensuring compliance with regulatory standards? Option A. The lowest initial purchase price of the equipment, regardless of its performance specifications or regulatory approval. Option B. Adherence to the specific regulatory framework and guidelines for medical laboratory operations, including equipment validation, calibration, and maintenance protocols. Option C. The availability of equipment that requires minimal user training, even if it does not meet established performance benchmarks. Option D. Personal familiarity and preference of the laboratory assistant with a particular brand or model of equipment. The correct answer is B. Adherence to the specific regulatory framework and guidelines for medical laboratory operations, including equipment validation, calibration, and maintenance protocols. Explanation. The scenario of selecting basic laboratory equipment for a medical laboratory assistant certification exam presents a challenge because it requires not just knowledge of equipment function, but also an understanding of how regulatory compliance dictates their selection and use. The certification exam aims to assess a candidate's ability to operate safely and effectively within a regulated environment, where adherence to standards is paramount for patient safety and data integrity. The correct approach represents best professional practice because it prioritizes adherence to the specific regulatory framework and guidelines relevant to the certified medical laboratory assistant certification. This includes understanding that equipment must meet established performance standards, be properly calibrated, and maintained according to manufacturer instructions and regulatory mandates, and be used in a manner that ensures accurate and reliable results. The regulatory framework for medical laboratories, even at the assistant level, often specifies requirements for equipment validation, documentation, and quality control, all of which are critical for maintaining a compliant and high-quality laboratory operation. An incorrect approach that focuses solely on cost-effectiveness without considering regulatory compliance is professionally unacceptable. This failure stems from a disregard for patient safety and the integrity of laboratory results, which are the primary objectives of regulatory oversight. Such an approach could lead to the use of equipment that does not meet performance specifications, is not properly maintained, or lacks the necessary documentation, thereby violating regulations that mandate the use of appropriate and validated equipment. Another incorrect approach that prioritizes personal preference or familiarity over established protocols and regulatory requirements is also professionally unacceptable. While experience is valuable, it must always be guided by and subservient to the governing regulatory framework. Deviating from approved equipment or procedures based on personal preference can introduce variability, compromise accuracy, and lead to noncompliance with quality assurance standards mandated by regulatory bodies. A third incorrect approach that neglects the importance of proper training and competency assessment for the chosen equipment is equally problematic. Even if the equipment itself is compliant, its effective and safe use is dependent on the personnel operating it. Regulatory frameworks often implicitly or explicitly require that staff be adequately trained and competent in the use of all laboratory equipment. Failure to ensure this competency can lead to errors, equipment damage, and potential safety hazards, all of which are regulatory failures. Professional decision-making process for similar situations should involve a systematic evaluation of equipment options against the specific requirements of the regulatory framework governing the medical laboratory. This includes 1. Identifying all applicable regulations and guidelines for the specific certification and laboratory setting. 2. Assessing equipment based on performance specifications, accuracy, precision, and suitability for the intended tests. 3. Verifying that the equipment meets all relevant certification and accreditation standards. 4. Ensuring that appropriate calibration, maintenance, and quality control procedures are available and can be implemented. 5. Confirming that personnel operating the equipment will receive adequate training and demonstrate competency. 6. Considering cost-effectiveness as a secondary factor only after all regulatory and performance requirements have been met. Question 18. To address the challenge of ensuring the integrity of a patient's blood sample collected for routine chemistry analysis during transport to the main laboratory, which of the following approaches best adheres to established medical laboratory protocols and best practices for specimen handling? Option A. Use a sterile, leak-proof blood collection tube containing the appropriate anticoagulant, as specified by the laboratory's protocol, and transport it at ambient temperature. Option B. Transfer the blood sample into a reusable plastic container that has been washed and dried, and send it via courier without considering temperature. Option C. Place the blood sample in a standard clean glass jar sealed with a lid and transport it at room temperature. Option D. Collect the blood sample in a plain, unsealed vial and instruct the courier to keep it in a cooler bag with ice packs, regardless of the specific testing requirements. The correct answer is C. Place the blood sample in a standard, clean glass jar sealed with a lid and transport it at room temperature. Explanation: scenario analysis. This scenario presents a common challenge in medical laboratory settings, ensuring the integrity of patient specimens during transport. The professional challenge lies in balancing the need for timely sample delivery with the critical requirement of maintaining specimen viability and preventing contamination or degradation. Failure to adhere to proper transport protocols can lead to inaccurate test results, delayed diagnoses, and potentially compromised patient care. The medical laboratory assistant, MLA, must exercise careful judgment in selecting appropriate containers and conditions based on the specific type of specimen and its intended analysis. Correct approach analysis. The correct approach involves selecting a transport container and conditions that are specifically designed to maintain the integrity of the specimen throughout the transit period. This typically means using a leak-proof, sterile container that is appropriate for the type of sample, e.g., a sterile tube for blood, a specific container for urine or tissue. Furthermore, maintaining the correct temperature is paramount. For many biological samples, ambient temperature is acceptable, but others may require refrigeration or even freezing to prevent cellular breakdown, bacterial growth, or denaturation of analytes. Adhering to these specific requirements, as outlined by laboratory protocols and manufacturer guidelines for transport media or kits, directly supports the accuracy and reliability of laboratory testing, which is a core ethical and professional responsibility of an MLA. This aligns with general laboratory best practices and regulatory expectations for specimen handling. Incorrect approach is analysis. Using a generic, non-sterile container for a biological specimen is a significant regulatory and ethical failure. Non-sterile containers introduce the risk of contamination, which can lead to false positive or false negative results, directly impacting patient diagnosis and treatment. Furthermore, a non-leak-proof container poses a biohazard risk to laboratory personnel and the public, violating safety regulations and ethical obligations to prevent harm. Transporting a temperature-sensitive specimen at ambient temperature when refrigeration is required is another critical failure. Many biological markers and cellular components degrade rapidly at room temperature. This degradation can render the specimen unsuitable for analysis, leading to the need for recollection, which causes delays in diagnosis and increased costs. This violates the principle of providing accurate and timely diagnostic information. Using a container that is not designed for the specific type of specimen, such as using a standard blood tube for a delicate tissue sample that requires preservation in a specific fixative, is also professionally unacceptable. Different specimens have unique requirements for preservation to maintain their diagnostic integrity. Failure to use the correct container can lead to sample deterioration and inaccurate results, undermining the reliability of the laboratory service. Professional reasoning. Professionals in medical laboratory settings should employ a systematic decision-making process when handling specimen transport. This process begins with identifying the type of specimen and the intended laboratory test. Next, consult established laboratory protocols, standard operating procedures (SOP), and any specific instructions provided with transport kits or media. These documents will detail the required container type, any necessary preservatives or additives, and the appropriate temperature conditions for transport. If there is any ambiguity or uncertainty, the MLA should always seek clarification from a supervisor or a qualified laboratory professional before proceeding. Prioritizing specimen integrity, patient safety, and regulatory compliance at every step is essential. Question 19. Analysis of a medical laboratory assistance decision-making process for selecting personal protective equipment, PPE, for a new diagnostic assay involving potentially infectious respiratory samples. Considering the assay's protocol involves sample preparation, centrifugation, and automated analysis, which of the following approaches best aligns with regulatory requirements and best practices for ensuring laboratory safety and preventing occupational exposure? Option A. Choosing PPE that is readily available and comfortable for extended wear, assuming that standard laboratory PPE is sufficient for all procedures. Option B. Relying on the PPE recommendations provided by the equipment manufacturer for the automated analyzer, without considering the risks associated with manual sample preparation and centrifugation. Option C. Selecting PPE based on the general requirements for handling biological specimens, without a specific assessment of the risks posed by the respiratory samples or the steps in the new assay. Option D. Conducting a detailed risk assessment that identifies potential hazards at each step of the new assay, evaluates the likelihood and severity of exposure, and selects PPE e.g. gloves, lab coat, eye protection, and potentially respiratory protection that provides an appropriate barrier against identified risks, referencing laboratory safety manuals and manufacturer guidelines. The correct answer is C. Selecting PPE based on the general requirements for handling biological specimens, without a specific assessment of the risks posed by the respiratory samples or the steps in the new assay. Explanation. Scenario analysis. This scenario is professionally challenging because selecting appropriate personal protective equipment, PPE, for a medical laboratory assistant involves a dynamic risk assessment. The assistant must consider not only the immediate task, but also potential unseen hazards, the specific nature of the biological agents being handled, and the potential for splashes or aerosols. Failure to accurately assess these risks can lead to inadequate protection, increasing the likelihood of exposure and subsequent infection or injury, which directly impacts patient safety and laboratory integrity. Correct approach analysis. The correct approach involves a systematic, evidence-based risk assessment that prioritizes the hierarchy of controls. This aligns with regulatory frameworks such as those from OSHA, Occupational Safety and Health Administration, in the U.S., which mandate employers to provide a safe working environment. Specifically, the assessment should identify the hazards associated with each procedure, evaluate the likelihood and severity of potential exposure, and then select PPE that offers the highest level of protection against those identified risks. This includes considering factors like the type of specimen, the procedures performed e.g., centrifugation, vortexing, pipetting, and the potential for aerosol generation. The selection must be guided by laboratory safety manuals, manufacturer guidelines for PPE, and relevant public health recommendations. This proactive and thorough approach ensures compliance with safety regulations and upholds the ethical responsibility to protect oneself and prevent the spread of infection. Incorrect approaches analysis. One incorrect approach is to rely solely on general laboratory attire without a specific risk assessment for each task. This fails to acknowledge that different laboratory procedures carry varying levels of risk. It violates the principle of hazard identification and risk mitigation mandated by safety regulations. Ethically, it demonstrates a disregard for the potential harm to oneself and others. Another incorrect approach is to select PPE based on cost or convenience rather than the level of protection required. This prioritizes economic factors over safety, which is a direct contravention of occupational health and safety laws. It also represents an ethical failure to adequately protect oneself and potentially compromise laboratory safety protocols. A third incorrect approach is to assume that PPE used for one type of specimen or procedure is adequate for all others. This overlooks the critical need for task-specific risk assessment. Different biological agents and procedures require different levels of barrier protection. Failing to adapt PPE selection based on evolving risks is a regulatory failure and an ethical lapse in professional diligence. Professional reasoning. Professionals should employ a decision-making process that begins with understanding the specific tasks and the biological agents involved. This should be followed by consulting established laboratory safety protocols and relevant regulatory guidelines. A thorough risk assessment should then be conducted for each procedure, considering the potential routes of exposure, e.g., inhalation, ingestion, skin contact, mucous membrane contact. Based on this assessment, the most appropriate PPE should be selected, prioritizing the highest level of protection that is practical and effective for the task. Regular review and updating of these assessments and PPE selections are crucial to maintain a safe laboratory environment. Question 20. System analysis indicates that an autoclave and an incubator in the medical laboratory have recently undergone scheduled maintenance and have been out of service for a period of 1 week. Prior to resuming routine use for patient sample processing and culture incubation, what is the most appropriate course of action for a certified medical laboratory assistant to ensure the integrity of laboratory operations and patient safety? Option A. Proceed with routine use of the autoclave and incubator, assuming they are functioning correctly as no error messages were displayed during the maintenance period. Option B. Perform a full verification of both the autoclave and incubator, including running test cycles and confirming all critical parameters with appropriate indicators and calibrated monitoring devices, and meticulously document all findings before resuming normal operations. Option C. Conduct a brief visual inspection of both the autoclave and incubator, and only initiate a test cycle if a specific issue is immediately apparent. Option D. Rely solely on the maintenance logs provided by the service technicians to confirm the equipment is ready for use. The correct answer is B. Perform a full verification of both the autoclave and incubator, including running test cycles and confirming all critical parameters with appropriate indicators and calibrated monitoring devices, and meticulously document all findings before resuming normal operations. Explanation. Scenario analysis. This scenario presents a common yet critical challenge in a medical laboratory, ensuring the sterility of instruments and the viability of cultures. The professional challenge lies in the direct impact of equipment malfunction on patient safety and diagnostic accuracy. A failure in either the autoclave or incubator can lead to the use of contaminated instruments, resulting in false negative or false positive results, and potentially compromising patient care. The medical laboratory assistant, MLA, must exercise meticulous attention to detail and adhere strictly to established protocols to mitigate these risks. Correct approach analysis. The correct approach involves a systematic and documented process of verifying the functionality of both the autoclave and incubator. For the autoclave, this means confirming that the sterilization cycle parameters, temperature, pressure, time, were met, often through visual indicators on the autoclave itself and by checking biological or chemical indicators. For the incubator, it involves verifying that the set temperature and atmosphere, if applicable, are maintained within the specified tolerances, typically through calibrated thermometers or the incubator's internal monitoring system. This rigorous verification process directly aligns with the fundamental principles of good laboratory practice, GLP, and the specific guidelines for medical laboratory equipment maintenance and validation, ensuring that all procedures are performed with validated and sterile equipment. Adherence to these documented checks is a cornerstone of quality assurance in a medical laboratory setting, preventing the introduction of errors at the pre-analytical stage. Incorrect approaches analysis. One incorrect approach is to assume that because the equipment was functioning correctly during the previous use, it will continue to do so without verification. This bypasses essential quality control steps and violates the principle of continuous monitoring and validation. Regulatory frameworks for medical laboratories mandate that all critical equipment be verified before use, especially after maintenance or periods of inactivity, to prevent the propagation of errors. This approach represents a significant ethical failure as it prioritizes expediency over patient safety and diagnostic integrity. Another incorrect approach is to rely solely on the equipment's internal error logs without performing independent verification. While error logs can be informative, they do not guarantee that the equipment is operating within its specified parameters for the current cycle. For instance, an autoclave might not log an error if it reaches the correct temperature, but fails to maintain the correct pressure for the required duration. This approach fails to meet the standard of care expected in a regulated medical laboratory, where independent verification of critical parameters is paramount. This constitutes a regulatory failure by not adhering to established validation protocols. A third incorrect approach is to only perform verification if a specific problem is suspected or reported. This reactive approach is contrary to the proactive quality management systems required in medical laboratories. Preventive maintenance and routine verification are designed to identify and rectify potential issues before they impact patient results. Waiting for a problem to manifest is a failure to implement a robust quality assurance program and can lead to widespread contamination or inaccurate results, posing a direct risk to patient care and violating ethical obligations to maintain a safe and reliable laboratory environment. Professional reasoning. When faced with equipment that has undergone maintenance or has been idle, medical laboratory assistants should follow a decision-making process that prioritizes patient safety and diagnostic accuracy. This involves 1. Consulting the laboratory's standard operating procedures, SOP, for equipment verification after maintenance or periods of inactivity. 2. Performing all mandated verification checks for the autoclave, including visual inspection of seals, confirmation of cycle parameters, and appropriate indicator testing. 3. Performing all mandated verification checks for the incubator, including temperature monitoring with calibrated devices and ensuring atmospheric conditions are stable. 4. Documenting all verification results meticulously in the equipment's logbook. 5. Reporting any discrepancies or failures to the appropriate supervisor or designated personnel immediately. This systematic, documented, and proactive approach ensures compliance with regulatory requirements and upholds the highest ethical standards for patient care.